Is Dihexa a prescription drug? Now, this is a really interesting question because Dihexa is an angiotensin peptide, and also known as an oligonucleotide. And so it's this very unique structure, but what the researchers found is that the angiotensin 2 pathway was very important in conditions like Parkinson's and Alzheimer's, but using that peptide, it would get broken down too quickly in the gut and it wouldn't get through the blood-brain barrier. So what they did is they created an analog of the angiotensin 2 by utilizing the angiotensin 4 pathway and making Dihexa. And Dihexa, when it's sequenced in the right way, you're going to see that these covalent bonds and the sequences of peptides, or these small little protein chains, are put together perfectly. It's not easy, and not all Dihexa is created equal. A lot of the Dihexa that you'll be able to buy online or from a research pharmacy, it's not always what it says it is. And so we pride ourselves in the fact that we use only compounding pharmacies who are licensed and FDA-approved pharmacies. They have to go through rigorous testing, and they do get very high standards. We work with pharmacists like Leonard Pastrana at New BioAge, or like Mike Caruso, VPI, and these are phenomenal pharmacists who really care about their craft. So while Dihexa can be purchased over the counter, if you want to get the right Dihexa, you want to use it as a prescriptive source. You want to work with a doctor who can actually get you the right dosing and get the peptide from the right pharmacy. So in this video, what you're going to learn is exactly where to source Dihexa, the differences in Dihexa that you can get over the counter versus through a prescription, and by the end, you're going to know what's right for you. And so let's jump in. Okay, so if you think of the nature of Dihexa when you're working on your brain, I don't know about you, but I don't want to take any chances on my brain. I want the very best of the best. Now, Dihexa, as I mentioned earlier in the video, it works on the angiotensin pathway. So this is an angiotensin peptide, but specifically angiotensin 4. And the reason why it's an angiotensin 4 and not an angiotensin 2 is because the angiotensin 4 is what allows us to get Dihexa through the blood-brain barrier without getting broken down by the gastric secretions in your gut. So you can take this orally, or you can apply it topically. And what you'll find is that Dihexa creates an enormous amount of benefits in the brain. If you're looking for better cognitive clarity, if you want to learn things faster, if you want to have more creativity, more mental resilience, Dihexa is just a phenomenal peptide. Now, I do have a video that talks about how you can accelerate the transmission and the activation of Dihexa. So if you want to really start activating that angiotensin 4 pathway, there's a couple of things you can do, like low dose nicotine. You can do intranasal stem cells. You can eat some fish and blueberries, get the omega-3s, and then you can do high intensity exercising. But if you're thinking about why would I want to have a prescriptive based Dihexa, well, I'm going to give you 3 reasons why it doesn't make sense to not work with a doctor or not work with a clinical facility that actually has knowledge of Dihexa. Thing number 1 is at East West Health. It's a company I founded 21 years ago. We've helped almost 70,000 clients achieve optimal health. And what we do is we pride ourselves on getting the right tests up front. And so ask yourself, if you're noticing cognitive decline, what's the cause? And a lot of us, we fall to our primary bias, which is, well, I'm stressed, I don't sleep well, and I just need something to help give me a pop throughout the day. Well, Dihexa is going to help, but it's not going to be the long-term solution. The long-term solution is looking at the whole body and saying, what's the cause of the cause? So I got into natural medicine because I was misdiagnosed. I was on the conventional medical track. I was at the University of Utah, and I didn't get the answers I was looking for in my own health journey. All the doctors told me is, you're too stressed. And I was like, I grew up on a cattle ranch. This is not stressful. I actually really love school and I love learning, but my brain's not working. And turns out when I actually had the right test ran, I could have just popped Dihexa for years, and it maybe would have improved things 5 or 10%, but it wouldn't have popped me out of that severe brain fog I had. It wasn't until we learned that it was the amount of chemicals that I was exposed to and the way that it triggered my immune system that I was in an autoimmune state, a disease called Hashimoto's. But once we cleared up my gut, we did detoxification, my brain came back online. So those of you who have not ventured down the road of finding out what could be interfering with my brain performance, the very first step is go to agelessfuture.com and get your free health span assessment. It will change your life because we can determine what tests are going to be necessary to figure out what is interfering with your progress. The second reason why working with a great doctor or a great clinic is you know where it's sourced from. So not all peptides are created equal. Even if it says the same thing on the bottle, what we've learned is that some of the peptide manufacturers, they're just out there to sell peptides. I was chatting with an individual a few days ago, and he had a company that was doing like $30 million in peptide sales and until the government shut him down. And it's baffling. And that still goes on and is going on more and more today. What we do is we take out the urgency and the need to sell peptides because we're putting together protocols for you, and then you purchase it through a pharmacy, and we have our doctors that write the prescriptions. I work with my doctors on the team and they give me the prescriptions. A lot of time I'm informing them on what I'm looking for and what my outcomes that I'm looking for, what expecting them to be based on the peptide structures. And I've obsessed over how to stack the right peptides at the right time based on labs throughout my entire career. And when I can get those peptides through a compounding pharmacy, because originally I didn't know of any compounding pharmacies that were making them. And so I was using research use only peptides, and I noticed a little bit of an improvement, but the data was so compelling, I kept digging and digging, and then finally we found a pharmacy that would start making these peptides. And so we had our doctors prescribe it, and it made such a difference in my own personal life. So it's not only like you work with a doctor on a prescriptive basis, but make sure they have the knowledge of peptides and they're trained in it. And then also make sure you're running the right tests. And then the third reason why I think working with a prescriptive-based peptide is because you don't want to take chances with your future. You know, we've got one brain, we've got one body. You need to make the most of it. That's my belief anyways. You can choose for yourself. But when it comes to my brain, I want to make sure that I'm doing everything I possibly can for it. After I did the intranasal stem cell treatment, yes, it was a big investment. And it was also something that I didn't have anyone else that I could talk to about it. But I saw the data. I was at a stem cell conference. I saw what Arnold Kaplan, the research he was able to do with intranasal stem cells, and watching the stem cells migrate into parts of the brain that had been damaged, I realized, I was like, this is what I need to do for my brain. And so I went back to the clinic. I took action immediately. And I experienced enormous benefits where I had 11 hours of sleep and all the memories were consolidated, and it was like someone silenced my brain and consolidated everything to the point where I could start writing books, I could read again. I felt like I experienced life in a whole new way. And I've seen that in hundreds of patients who've done the same procedure. Now, when you're protecting your brain and when you're doing everything that you need to do for it, you don't want to second guess it. You don't want to take chances. And that's one of the reasons why Dihexa, and when used as a prescriptive based, it can be life-changing because you know you're getting the highest quality. You've got a team that runs the right functional medicine testing, so getting your blood work done, getting your neuro check, your brain scan, getting your gut tested, looking at any kind of heavy metals, infections in your body. These are all such important things to do before you engage in this brain optimization pattern. And so for those of you who want to go deeper and you love what you've learned about Dihexa, I've got a whole video on what it's used for, and I've provided that link in the notes below. I'll see you in the next video.